Did you know that up to 30% of seniors over the age of 60 experience muscle weakness and leg instability? Not because of aging, but because of the very vitamins they take each day? It may sound surprising, but the truth is that many common supplements marketed as health boosters could actually be doing more harm than good, especially when it comes to your legs. So, in today's video, we're going to uncover the top 4 vitamins that might be quietly destroying your leg strength and show you how to avoid the hidden dangers they bring. All right, without any delay, let's begin with a vitamin that almost every senior is told to take: vitamin D. You hear about it from your doctor, on health shows, and in just about every bone-strengthening supplement on the shelf. It is recommended for stronger bones, improved immunity, and even better balance to help prevent falls. But what most people are never told is that when it is misused or taken without the right precautions, it can quietly start damaging your muscles, especially in your legs, rather than helping them. So let's take a closer look, because this is where many people unknowingly go wrong. First, let's start with what vitamin D actually does. One of its main jobs is to help your body absorb calcium from the food you eat or the supplements you take. Calcium is essential for building and maintaining strong bones. Without enough vitamin D, your body struggles to absorb calcium efficiently, which can lead to bone loss and a higher risk of fractures. So yes, vitamin D is important. But here's the part that gets overlooked. What happens when you have too much? When your vitamin D levels go too high, it triggers your intestines to absorb more and more calcium, even if your body doesn't need it. This leads to a condition called hypercalcemia, which means there is too much calcium in your bloodstream. That might sound harmless at first, but it creates a dangerous effect that directly affects your muscles and your nervous system. Here's why that matters. Calcium does not just go to your bones. If there is too much of it in your blood, your body begins storing it in places it should not, like your soft tissues. This includes your muscles, arteries, kidneys, and even your joints. In the legs, this buildup can lead to stiffness, pain, or a constant heavy sensation that makes movement harder. The muscles can begin to feel tight or slow to respond, and your legs may feel weaker even if you are staying active. On top of that, your nerves are extremely sensitive to calcium levels. When the balance is thrown off, it can disrupt nerve signaling, leading to symptoms like tingling, cramping, or even fatigue. Some seniors feel like their legs are not listening the way they used to. This may not just be aging, but a sign of poor calcium regulation caused by excess vitamin D. And one of the most dangerous places calcium can build up is in your arteries. When calcium deposits settle into the walls of your blood vessels, it can cause them to stiffen and narrow. This condition, known as arterial calcification, reduces blood flow to your muscles and organs. Poor circulation in the legs can cause pain while walking, cold feet, slower healing, and increased fatigue. And in the long term, calcified arteries can raise your risk of heart disease, high blood pressure, and stroke. Now, here is a major mistake that many seniors unknowingly make, one that can make the situation even more dangerous. Most people take vitamin D by itself, completely unaware that it needs to be paired with another critical nutrient: vitamin K2. Vitamin K2, especially in the MK7 form, plays a key role in calcium regulation. It helps direct calcium away from your blood vessels and soft tissues and guides it toward your bones, where it belongs. Without enough K2, all that extra calcium your body absorbs can get stuck in the wrong places, leading to arterial calcification, joint pain, and chronic leg weakness. That is why pairing vitamin D with K2, especially the MK7 form, is so important. Yet, most over-the-counter vitamin D supplements do not include K2, and sometimes doctors do not mention this crucial pairing. So, how do you take vitamin D safely? For most seniors, a daily dose of 800 to 1,000 international units is enough to support healthy bones and immunity. However, Some people take 2,000, 5,000, or even 10,000 units a day without knowing their current vitamin D status. That is why it is so important to get a 25-hydroxy vitamin D blood test before you start or increase your supplement. This test shows exactly how much vitamin D is in your system and whether you even need more. If your blood levels are below 20 nanograms per milliliter, supplementation may be necessary. But if your levels are already in the healthy range, typically between 30 and 50, then adding more could actually push you into toxicity. And once calcium starts building up in your soft tissue, the symptoms are slow and subtle until they become hard to ignore. It is also important to take your vitamin D with food that contains fat, because it is a fat-soluble vitamin. That means your body absorbs it better when you eat it with something like eggs, avocado, or olive oil. And if you are taking calcium supplements as well, make sure that the combination is supervised by a healthcare provider. Taking both in high doses without guidance increases your risk of calcium overload, which could lead to nausea, muscle twitches, and even kidney stress. Moreover, you can also support your vitamin D levels naturally. Spending 15 to 20 minutes in the sun a few times a week allows your skin to make its own vitamin D. Foods like salmon, egg yolks, mushrooms, and fortified cereals also provide natural sources that are easier for your body to regulate. So yes, vitamin D is essential, but only when taken the right way. Make sure you are getting the right dose, pair it with K2, eat the right foods with it, and test your levels regularly. Because the goal is not just strong bones, it is strong, pain-free legs that carry you confidently every single day. All right, now that we've talked about the risks of misusing vitamin D, let's turn to another commonly used supplement, vitamin E. Many seniors take it because it's believed to protect the heart, boost immunity, and keep skin looking healthy. It sounds like a great idea, especially with how often it's promoted as a powerful antioxidant. But here's what most people do not realize. The wrong type or dose of vitamin E can actually interfere with your body's natural repair systems, and over time, quietly weaken your leg strength and stability. Let's break down how it happens. Your body does need vitamin E, but it only needs a small amount, around 15 milligrams, or 22.4 international units per day. In healthy amounts, vitamin E serves as a potent antioxidant, helping to prevent oxidative stress and chronic inflammation in the body. These two factors are linked to many diseases, including heart disease, diabetes, and even cancer. So, in moderation, vitamin E plays an essential role in protecting your cells and maintaining overall health. However, the problem arises when you take too much, especially in the form of synthetic vitamin E, which is often labeled as D-L-alpha tocopherol. This form is cheaper and widely used in supplements, but your body processes it differently than the natural form, which is labeled as D-alpha tocopherol. Now, here's where it gets concerning. After walking, stretching, or doing any physical movement, your muscles need to recover. Your body creates a small, healthy amount of inflammation to help with this repair process. But when there's too much synthetic vitamin E in your system, it can actually block this natural inflammatory response. And if your muscles do not repair properly, they gradually become weaker and more prone to strain. So, instead of building strength from activity, your legs may feel sore longer than usual, or you might find that you are not recovering like you used to. Even more important, excess vitamin E can slow down the communication between your brain and your muscles. This connection is critical for quick reflexes, balance, and coordination. When it becomes disrupted, your legs may respond more slowly, making you feel off balance or even wobbly. Over time, this could lead to more stumbles or even falls, something no one wants to risk as they age. And the problems do not end there. High doses of synthetic vitamin E have also been linked to a higher risk of hemorrhagic stroke in older adults. That is the type of stroke caused by bleeding in the brain. This becomes an even greater concern if someone is taking blood-thinning medications, which many seniors are. Combining both without medical guidance can quietly increase the danger without any warning signs. So the question becomes, how can you make sure you are getting vitamin E safely? First, consider whether you even need a supplement at all. Many people can get enough vitamin E from food, which is the safest and most balanced way to absorb it. Whole foods provide vitamin E in forms your body knows how to use properly, without the risk of overdose or unwanted side effects. Foods like almonds, sunflower seeds, avocados, spinach, and olive oil are excellent natural sources. They also come packed with other nutrients and healthy fats that help support your body in more ways than a pill can. However, if you are going to use a supplement, always check the label. Look for the natural version of vitamin E, D-alpha tocopherol, not the synthetic DL version. And unless your doctor specifically recommends it, do not take more than 400 international units per day. Beyond that point, the risks start to increase significantly. And if you've already been taking high-dose vitamin E and notice things like slower walking speed, difficulty climbing stairs, feeling off balance, or soreness that lingers even after minimal activity, these may be signs your supplement is doing more harm than good. To be sure, it's a good idea to test your vitamin E levels through a simple blood test. If the results show that your levels are below normal, typically around 12 to 18 micromoles per liter, it may indicate a deficiency, and supplementation might be necessary. But if your levels are already within the healthy range, generally between 20 and 40 micromoles per liter, then adding more vitamin E could push you toward an overdose, potentially leading to the issues we've discussed. So the good news is, it is often as simple as adjusting your dosage or switching to food-based sources to feel better and move with more strength. Moving forward, let's dive into another common supplement. Vitamin A. This vitamin is essential for a variety of reasons, supporting healthy skin, boosting immunity, and maintaining good vision. It seems like an easy win for seniors looking to support their overall health. However, as with many supplements, the reality is a little more complex. While vitamin A is undoubtedly important, taking too much, especially in the form of preformed vitamin A, or retinol, can cause some surprising and potentially harmful effects on your muscles and bones. So, what exactly happens when you get too much of this vitamin? Well, when you take excessive amounts of preformed vitamin A, the body stores it in the liver, and over time, this buildup can start to interfere with other essential processes in the body. One of the most crucial systems that gets disrupted is calcium regulation. Calcium is vital for your bones, muscles, and overall muscle function. But too much vitamin A can hinder the body's ability to manage calcium correctly. Here's how. Vitamin A interferes with the proper functioning of vitamin D, which is, as mentioned earlier, necessary for the absorption of calcium. Without the correct balance of vitamin D, calcium can't be absorbed into your bones where it's needed most. This imbalance leads to a troubling outcome. Instead of being directed to your bones, calcium may accumulate in soft tissues or muscles, causing them to become stiff and tight. It's a vicious cycle that worsens over time. Your muscles, particularly in your legs, may begin to feel sore, weak, or cramp more frequently. Even walking, climbing stairs, or standing up for long periods could feel like a chore. As calcium is improperly stored, the muscles become less responsive and overall muscle recovery slows down, leading to a decline in strength and mobility. Moreover, this improper regulation of calcium not only affects your muscles, it impacts your bones too. When calcium isn't properly absorbed into your bones, it can lead to bone loss, weakened bones, and an increased risk of fractures, particularly in the hips. The risk of these injuries is especially concerning as you age because healing can be slower and complications more severe. And it's not just about bone health either. If the calcium is not where it's supposed to be, it may even affect your joints, causing pain and further limiting mobility. All these factors together create a perfect storm that compromises your ability to stay active and maintain your independence. So, how much vitamin A should you be taking to avoid these negative effects? The recommended dietary allowance for vitamin A is 700 micrograms of retinol activity, equivalents, or RAE, for women and 900 micrograms RAE for men. The upper limit of safe intake is 3,000 micrograms, or 10,000 international units per day. Exceeding this amount can put you at risk for the issues we've discussed. To stay safe, it's a good idea to avoid high-dose vitamin A supplements that contain retinol or retinol palmitate. Instead, focus on plant-based sources of vitamin A, such as beta-carotene, which your body converts into vitamin A as needed. This reduces the risk of overconsumption because your body regulates the conversion process itself. For instance, foods like carrots, sweet potatoes, spinach, kale, and pumpkin are excellent sources of beta-carotene. These are not only safer, but also provide a wealth of other nutrients that support your overall health. If you're already experiencing symptoms like dry skin, brittle nails, stiff or crampy legs, chronic fatigue, or difficulty with movement, especially after walking or climbing stairs, it could be a sign that your vitamin A intake is too high. So, adjusting your intake or switching to plant-based sources might help alleviate these issues and restore mobility and strength to your legs. All right, now that we've discussed vitamin A and its potential impact on your bones and muscles, let's turn our attention to vitamin B6, which is commonly used by seniors to support nerve health, mood, brain function, and energy levels. And it sounds like a great addition to a healthy lifestyle. However, as with many supplements, there's a fine line between benefit and harm. And in the case of vitamin B6, taking too much can lead to some serious issues, especially in your legs and feet. So, what's happening when you take more vitamin B6 than your body actually needs? Well, the excess of this vitamin can lead to a condition known as peripheral neuropathy. This is a type of nerve damage that causes symptoms like numbness, tingling, burning, or even weakness, most notably in your legs and feet. Imagine trying to take a walk or climb a flight of stairs, only to feel like your legs aren't fully cooperating. That's what happens when too much vitamin B6 starts interfering with your nerve function, leaving you struggling with balance and mobility. And here's where things get tricky. Many seniors unknowingly overdose on vitamin B6. It's not just the B6 supplements you might be taking, it's also hidden in many B-complex vitamins, energy drinks, and protein powders. These everyday products can add up, and before you know it, you've exceeded the safe daily limit. Most people aren't aware that all these sources of B6 combine to increase the risk of toxicity. So, while you might think you're supporting your health, in reality, you might be consuming far more than your body can handle. What's even more concerning is that the symptoms of B6 toxicity aren't always immediate. They can last for months or even years, long after you stop the supplement. The safe daily dose for seniors is around 1.5 milligrams, but nerve damage has been reported with just 50 to 100 milligrams per day when taken long term. Now, you might be wondering, how do I know if I'm taking too much? Well, if you start noticing tingling in your feet or legs, or if you feel a burning sensation in the soles of your feet, it could be an early sign of B6 toxicity. Other signs include difficulty walking, poor balance, or a feeling like your legs are asleep. These symptoms may be subtle at first, but can become more severe over time if not addressed. If you're experiencing any of these symptoms, it's crucial to stop taking high doses of vitamin B6 unless specifically prescribed by your doctor. To be safe, take a moment to review all of your supplement labels and track how much B6 you're getting each day. If you're concerned or unsure, don't hesitate to consult your healthcare provider. It's always better to be proactive when it comes to your health. The good news is that you don't need to rely on supplements to get the benefits of vitamin B6. There are plenty of natural low-risk sources that can support your nerve health without putting you at risk. Bananas, oats, tuna, salmon, chickpeas, and spinach are all excellent choices that provide B6 in a safe and balanced way. By focusing on food-based sources, you can ensure that you're getting the right amount of vitamin B6 without the risk of overdose. And there you have it, 4 common vitamins that could be silently impacting your health, especially your legs, strength, and mobility. So, if you found this information valuable, make sure to hit that like button to help it reach more people who need to hear this. Share it with your friends and family, and don't forget to comment, subscribe, and stay tuned for more tips on how to make everyone's golden years filled with strength, energy, and independence.